Now, without any further delay, the flight from Australia has boarded to fly into the United Kingdom. We are flying high altitude and it is a long journey to UK. My ears are blocked, they're popping, they're ringing. I'm having sleep difficulties because I suffer sleep problems. I need to get to England and absolutely find a person who's going to help me with that. And the right gentleman who's going to be talking about that is our professor, Mr. Bhik Kotecha. He graduated from the Cardiff University in 1984 and started his training in the ear, nose, throat in Manchester as a senior house officer and a registrar. Moved to Sussex University to complete his thesis in ototoxicity before joining the Royal Ear, Nose and Throat Hospital as a senior registrar. He was appointed as an ENT consultant in the year of 1995 and has helped in establishing the sleep disorder unit at the Royal Hospital. In 2004, they were awarded the Hospital Doctor Team of the Year Award for Sleep Medicine. Bhik Kotecha is an examiner for MRCS at the Royal College of Surgeons of England and an assistant editor for the Journal of Laryngology and Otology. He's the immediate past president of the Sleep Medicine section at the Royal Society of Ear, Nose and Throat. A young gentleman, a very knowledgeable gentleman who speaks globally on his projects of sleep disorders. Today, I'm flying directly from Australia into his surgery because I'm having some ear problems and I'm having some sleep issues. So without further delay, let's hear from him, and he's going to be sharing some amazing information through COVID-19, and what we should be doing for our ENT health and wellness. So, Bhik Kotecha, it's all yours now.
Thank you very much, Lalit, for that very kind introduction. Namaste, everybody, and welcome to the Wellbeing session. And I would like to take this opportunity to thank Healing Our Earth organizers for providing this opportunity for me to share some of my thoughts with you. As Dr. Soda mentioned, I'm an ear, nose and throat consultant. And you may be wondering, why is an ENT consultant on here and why does he want to talk about COVID-19? Well, in the field of medicine and in illnesses, we often have a multidisciplinary input, and this is no exception. So what I'd like to do over the next few minutes is to share with you some of my thoughts in relation to the COVID-19 crisis that we've been facing. So I'd like to share my screen with you and see if I can get my presentation on. So I would like to begin by paying a tribute to the NHS frontline workers. And the gentleman on the left is one of our ENT consultant surgeon colleague who works in Burton in Derbyshire and unfortunately died at the Leicester Royal Infirmary due to coronavirus. He acquired this infection whilst treating a patient who presented to him with a throat abscess, not realizing that the patient had coronavirus, and then he caught it from him and subsequently was admitted to the Leicester Royal Infirmary and succumbed. There have been numerous NHS frontline workers who, in duty providing service to the patients, have lost their lives and been affected. And of course, there have been other individuals who are frontline workers other than NHS that have also been affected. So COVID-19 was first identified in Wuhan in December 2019, and hence it's called COVID-19. The virus is zoonotic, which implies that the animal is first infected, such as a bat, and this bat may pass it on to other animals like snakes and pangolin, which may in turn pass it on to humans. And subsequently, you'll have the human-to-human transmission. And I'm sure many of you have been listening to the media and you know about the R number or the R rate, which is looking at the rate of infection transmission, which we're hoping will diminish in due course and hence will overcome this terrible, challenging crisis. The coronavirus is basically working through viral droplets, and this would then be spread by coughing, sneezing, and talking. And of course, if you touch surfaces which are infected and then touch your mouth, your nose, and your eyes, then you're going to get yourself infected. Now, COVID-19 is predominantly a respiratory disease, so you would expect a chest physician or a pulmonologist to talk about these things. But there is a huge degree of overlap between symptoms, and some of the symptoms are coming into the sphere of ear, nose, and throat, or ENT surgeons. Now, you may well be aware that the early reported symptoms were described as having a fever or a high temperature, a new continuous cough, breathing difficulty, muscle ache, and fatigue. So as the name breathing difficulty implies, that it could be affecting your chest from a breathing purpose or your nose, because the first port of entry for breathing the air is your nose. And more recently, we've understood that anosmia, which is loss of sense of smell, is also a symptom in relation to COVID-19.
Dr. Kotecha,
sense of smell and taste are interrelated, and so the ENT involvement has become more prominent.
Mr. Kotecha, can I disturb you just for a second?
Sure.
We cannot see your screen. Are you screen sharing with us?
I am. I thought I was.
Yeah, so I thought that was the case too, but unfortunately, your valuable information, we cannot see it on the screen.
Okay, so let me just stop my show and then come back to it. Can you see the screen now?
At the moment, no. We can see your picture on the screen, but we can't see you. We can see you talking to us.
Click share. Can you see it now?
It says, yes, now we can. Thank you very much. We can see the screen share now.
Okay.
Yeah.
All right, my apologies. So as I mentioned, that the COVID-19 and ENT involvement, let me just go back a slide. So recently we described the anosmia, which is loss of sense of smell and taste, that have been identified as symptoms that may affect patients who've got COVID-19, and hence the ENT involvement was more prominent. So the ENT involvement is present there before the illness, during the illness, and after the illness. And I'd like to take this next few minutes to describe how. Before the illness, in the diagnosis, in the differential diagnosis, we really need to know that are the symptoms that patients presenting with due to COVID, or could they be due to some other ear, nose, and throat pathology? In the during one, which I'll talk in detail later on, we are actively involved in intervention in assisting the breathing and the ventilation, and at some stage also by surgery and performing tracheostomy, which I'll describe in detail later on. So I mentioned anosmia and loss of taste, I mentioned cough, and all these symptoms are present in COVID-19 or may be present in COVID-19, but they don't necessarily have to mean that you have a COVID-19. We have to exclude ENT problems. You can see in the slide above here where a patient is coughing. So as the cough goes, the droplets go up to a distance of 6 feet, and hence the 2-meter social distancing that has been suggested. Now, I mentioned earlier on about the ENT involvement and overlap. So in a patient who's got a cough, is this really due to COVID, or is it due to nasal pathology such as nasal catarrh or postnasal drip or rhinitis, or is it due to acid reflux, which can affect your throat and patients can cough? So these are the kind of things we need to distinguish and ascertain whether it's actually due to COVID-19 or is it due to an ENT pathology. So here on your left, I have a diagram which is a hemisection of the head, and isn't it fascinating how our brain, the limbic system, works in distinguishing different fragrances and odors, and whether it is a very mature cheese or the beautiful fragrance of a flower like a rose, we can distinguish. And what happens in COVID-19, as well as in other nasal pathology, is these receptors here at the top of the nose, or the olfactory receptors, will detect the molecules of smell that comes up and then transmit it along to the brain, where you recognize what smell that is. Now, recently we know that in patients who've had COVID, they may have the prodromal symptom of anosmia, which is loss of sense of smell, and this in turn would result in loss of taste. But we have to make sure that it is COVID and not any other nasal pathology. So here we have a slide which shows a deviated nasal septum, which means that the partition between your right and left nostril is deviated to one side. It will compromise your nasal passage, and you won't be able to breathe very well, and that might affect the sense of smell. Here on the right, you can see nasal polyps. Nasal polyps are essentially like swelling inside your nasal passages, like a bunch of grapes that block the olfactory epithelium, that block the smell receptors, and you can't smell. So when a patient has got a sense of smell problem, they may think they've got COVID-19 when they come to see me, and if I put my endoscope up their nose, I will see these polyps and tell them that you've actually got nasal polyps, you do not have COVID. Now, there's also an overlap between patients with nasal polyps and patients with asthma. We know that patients with nasal polyps and asthma fare much worse than patients with nasal polyps alone. So there are some links there as well. We then come to allergic rhinitis and seasonal rhinitis. And recently there was an article that was emphasizing the fact that patients with allergic rhinitis may feel that they've got coronavirus or COVID-19 because the symptoms can be somewhat similar. In particular, the secondary effects of this symptom, of this condition, the allergic rhinitis, could cause lethargy, malaise, and sleep deprivation, and that can result in the tiredness, which you can also see in coronavirus. You will get the congestion of the nasal mucosa, the rhinorrhea is a runny nose, and you may get symptoms of sneezing and itching. Now, one of the tips for a clean, healthy nose is nasal douching or irrigation, and you may use a neti pot, as you can see here on the left of your screen, or you may want to buy products that are shown on the right of the screen, and I don't recommend any specific ones. All that I would say is that just make sure that you're using normal saline, which is 0.9% sodium chloride, because this is the one that is best for the nasal mucosa, the nasal lining. If you make this at home and you put too much salt or too little salt, then you will damage the lining of your nose. So it is best to stick to the ones that you can buy from the pharmacy. Now, the ENT involvement in the COVID patients during hospitalization occurs if a patient has been hospitalized and they're having breathing difficulty. In some patients, unfortunately, the breathing difficulty worsens and they subsequently end up going on to intensive care unit. Sadly, for these patients, we need to assist their breathing, so they may need to be intubated and be reliant on a mechanical ventilator. Some of these patients may need surgical assistance, where the ENT surgeon will come and perform a tracheostomy. And when stable, we reverse the tracheostomy. So I will explain a little bit more in detail as to what these things are. On the right of the screen, you see the patient lying down, and you can see that these are the vocal cords, and underneath the vocal cords is the trachea or windpipe. These are the kind of tubes that we will be inserting through the mouth, past the vocal cords into the trachea to help the patients breathe. Here you have the intubation line diagram. The tube is going through the mouth, passing through the vocal cords into the trachea here. And on the right, you can see the patient is on a ventilator with all these attachments and really doing unwell and being sedated because they cannot breathe on their own accord. Unfortunately, if you have a patient who's been intubated, here you can see the intubation tube, and the intubation is carried on for a long period of time, they develop complications, and the complications are those of granulomas. So this is a granuloma just on the right vocal cord, and this is a granuloma on both vocal cords. Now, if you develop these granulomas, then you'll have problems with breathing because it's compromising your laryngeal inlet and your windpipe underneath that. It'll compromise your voice, so you may become hoarse, husky, or croaky, and won't be able to talk properly or sing. So in order to prevent this complication, we as ENT surgeons are asked to come and see the patients and perform what we call a tracheostomy. Now, you may remember from the earlier slides that tubes that I showed you were much longer. These are much shorter tubes, the tracheostomy tubes. Here is the oral cavity, the lip and the chin. Here is the vocal cords, and here you can see the tracheostomy tube is going through the neck straight and directly into the trachea, the windpipe, and bypassing the upper airway. So if you compare the two diagrams here, you've got the intubation, the orotracheal intubation through the mouth, past the tongue, through the vocal cords into the windpipe. Whereas on the right of the screen, you've got the tracheostomy tube bypassing all this and going straight directly through the neck into the trachea. This helps the patients tremendously. It improves and reduces the work of respiration, and this is required in patients who have long-term intubation, and this is a commonly performed procedure in the patients who haven't done terribly well with COVID-19. So here you have the tracheostomy that is done by opening the neck up and the tube inserted, and you have a patient who's got a tracheostomy tube inside you. Now, just because you've got a tracheostomy tube, it doesn't mean you can't talk. You can get a speaking valve and you can talk. But this, remember, is a temporary measure until the patient has recovered from the illness, in this case, COVID-19. So now I just want to briefly mention how do we avoid the second COVID spike. It has been anticipated that there will be a second spike, and already in China, in Beijing and Shanghai, there are some new cases. So it is important and crucial that we follow the government guidelines in terms of social distancing, face mask and covering that is required on public transport, the hygienic aspect, particularly regular hand washing with soap and warm water for a minimum of 20 seconds. And obviously, it's good to work on your immune system and improve this in any form or shape if you can. Now, naturally, the immune system, the inheritance and the genetic factors are the most crucial ones, and this is something that you can do anything about. But what you can do is to improve your nutrition, make sure you've got a well-balanced diet, and I'm sure that future speakers, further speakers in the conference this evening are going to talk about nutrition and things like that. And vitamin D, I must state, is an important vitamin which is thought to be deficient in many individuals and an important factor in enhancing your immune system. Likewise, hydration, exercises and improving your fitness, reducing stress, and this would involve meditation and yoga. And again, we've got speakers later on who will focus specifically on this and to reduce stress and be happy. And the happy hormones will actually improve your immune system. And finally, good sleep. Now, as Lalit mentioned in the introduction, that one of my pet interests is sleep and sleep disordered breathing. So I just wanted to explain to you why we need sleep. We need sleep because our body has been awake for 16, 18 hours. And our body, in particular our brain, needs to rest. We need the regeneration and the repair processes to take place whilst we're asleep. And in order to do this, we need to have a minimum of 6 hours of sleep. It is thought that if you get less than 6 hours of sleep, sleep deprivation could have a higher incidence of developing blood pressure in patients. However, you know, in the past there are celebrities like the late Margaret Thatcher who slept only 3 or 4 hours and could manage with that, but this isn't good for you because later on you develop cognitive dysfunction such as dementia, and indeed she did have dementia. So the optimum sleep you need is for 7 to 8 hours. Now, the sleep disorders, it's a different session on its own accord, and if anybody's interested, you can look at my website on snoringmanagement.com, which will enlighten you on various aspects of sleep, particularly snoring and sleep apnea. So finally, I'd like to talk about COVID and BAME. As you know, the BAME, the Black, the Asians, and the minority ethnic community have an increased incidence and are more high-risk patients with COVID-19. And various factors have been speculated, in particular genetic predisposition, like Southeast Asians have a higher incidence of diabetes and blood pressure, and various other factors, like metabolism of vitamin D in the colored skin. I would like to make a little plea and ask you to help us help others. If you've been affected by the COVID-19, or if you've had relatives and unfortunately or sadly they've passed away, could you kindly help us with this questionnaire and log on to lcnl.org/survey and please participate in this questionnaire to give us more information and more detail about certain parameters of how it's affecting the ethnic minority, and this will help us enlighten the medical fraternity and perhaps help us with the future pandemics if we have any. I would like to thank you for your attention and for your listening. I wish you all well, keep healthy and stay safe. Thank you very much. Namaste.
Namaste to you, Bhikkhu. Thank you very much, Dr. Kotecha, Mr. Kotecha rather. on giving us an amazing explanation, very, very well explained with the diagrams of intubation and tracheostomy. It really, I mean, looking at those diagrams and the way you were pointing out with the arrows made it so interesting to see how the tubes go in our body. It's not a pleasant sight, though, I'm sorry to say, but it's very informative for us to learn what's going on. So thank you for sharing that with us. But before you go, Mr. Kotecha, what we would like to know is just a couple things from yourself, is that you're telling us about the COVID-19, the precautions we should be taking, and a lot of questions come up with wearing a facial mask. What benefit it is to the people wearing the mask, and is it they preventing the spread or they preventing the catch? You need to unmute yourself, Mr. Kotecha.
Thank you very much, Lalit. It's an interesting question. It is useful for both. Okay. So you get different types of masks, but any mask that you have and you cover your face and you cover your nose and your mouth rather, if you are infected yourself, you won't be spreading the infection to others. And also as you're breathing in, you saw from the slide, I don't know if you could see that slide because I wasn't sharing my screen properly in the first few slides. There's a distance of about 6 feet that these droplets can spread to. So anybody coughing nearby you, if you've got a mask, you'll be protected. And if you're coughing into the mask itself. So it works both ways, to protect yourself and to protect others.
So would you say, I know you did mention, but just to reiterate the process, that to prevent the second spike occurring, as what happened in China and the rest of the world, would you say the mask is a very essential thing that people should be wearing in a public environment?
Absolutely. The mask is very important, particularly in the transport, public transport, in supermarkets, in crowded places. It's only in open air we've got more than 2 meters distancing where you might not need it, but in other cases you should use it.
Brilliant. And without further delay, one more question, or rather a comment that we wanted to make, is you are actually conducting a study with the questionnaire that you mentioned on COVID-19. Just if you can describe a little bit more and as to where we'll get that questionnaire for the benefit of the audience, which is global right now, and if they can actually get the idea of the correct website. Would you just share something about that study with us, please?
Okay, so this study initiated at the North London Luhana community, the LCNL, Luhana Community North London, and I showed the link on my presentation. This was just restricted to our community first, but now we've extended it to other communities. So it will be useful for anybody from BAME, particularly the Asians, the Indians, Gujaratis, to log on to this website, which is lcnl.org/survey. And to take you to the questionnaire page, it will just ask you some demographic data about your age, your height, your weight, and about the drugs that you take, your past medical history, and your other illnesses. And we're looking and collating that data to see why is it so prevalent in the BAME community. Are there any specific factors? So we've asked about occupation and other people living in the same household, in extended families, etc.
Great, thank you. Ladies and gentlemen, everybody who's listening globally, help us with this research study. We can identify why, how the BAME community is being affected so much with COVID-19. Mr. Kotecha, a global namaste to you. Thank you very much for sharing your information with us. And we move on to our next wonderful speaker.